Okay, now, this should be pretty straightforward. We just talked about it. This is what happens with Parkinson's disease. And Parkinson's disease has to do with the direct pathway. Okay, it's definitely a problem with the direct pathway. And specifically what happens in Parkinson's disease is this substantia nigra is gone. And substantia nigra just represents the dopamine releasing neurons in the system. So going through and labeling, this is your substantia nigra. Here's your subthalamic nucleus. Here's your thalamus. GPI, GPE, putamen, and caudate nucleus. And the last player put in here is motor cortex. And again, you're thinking about moving. Bless you. Neural cell body here. And ideally, this is Parkinson's disease in the absence of the substantia nigra input is going to look just like the normal direct pathway that we saw a minute ago, where you have these axons from the motor cortex coming to putamen, caudate nucleus, hooking up with GABAergic neuronal cell body here, and caudate and putamen. And they send out axons to GPI, synapsed with another GABAergic neuron at GPI, and GPI neuron sends out axons so body and thalamus, and that communicates with the motor cortex. Since you don't have any input coming in here from the substantia nigra, you get the same situation where you have your increase in glutamate here, in here, okay? But in the absence of the synergistic dopamine, you're going to get the depolarization of this GABAergic neuron. So you're going to get some GABA, but less GABA than previously with the addition of dopamine. So you get some GABA. So we can say increasing GABA or less GABA overall. Let's change that to less GABA overall compared to normal. If there's less GABA here, that's going to result in more of an increase in GABA here. And if there's more of an increase in GABA overall here, you're going to end up with a decrease in movement. Okay? And that's all because you've lost the synergistic effect of the dopamine in the system. So Parkinson's patients have a decrease in their ability to initiate movements. And nothing different than we just talked about. Any questions about that? Yes? GABA. So yeah, so you're going to have, overall you're going to have less GABA compared to the normal situation. So if you have a synergistic effect with dopamine, you have even more GABA. Okay? So if you have a little bit less GABA compared to the normal situation, that's going to result in a little bit more GABA, because this neuron isn't going to polarise. Okay? If you have less, then you're going to have decreases in the neuron. Okay. That's the direct pathway or the Parkinson's pathway, and then the last one we need to look at is the indirect pathway. And the indirect pathway is going to be more specific for Huntington's disease. So here's the indirect pathway. In the indirect pathway, you should associate with stopping unwanted movements. Okay, stopping of unwanted movement is going to be your indirect pathway. So if we go through and label everybody, here's your substantia nigra. Subthalamic nucleus, and the subthalamic nucleus is going to play a role in the indirect pathway. Thalamus, caudate nucleus, GPI, GPE. Up here, you have the motor cortex. Again, you're thinking about movement. So, same situation. Neuronal cell body here in the motor cortex sends out axons to the striatum, which would be collectively the caudate nucleus and the putamen. Glutamatergic neuron. And then there's a small change because this neuronal cell body here and the caudate and the putamen, they send out an axon to a neuronal cell body that's located in the globus pallidus externus. Globus pallidus externus. So it doesn't go to GPI, it goes to GPE. And that synapses with another GABAergic neuron. Okay, globus pallidus externus. GABAergic neuron sends out an axon to the subthalamic nucleus. That synapses with a neuron, a glutamatergic neuron in the subthalamic nucleus. That sends out an axon that then synapses in the GPI with the GABAergic neuron. Synapses in the thalamus with a neuronal cell body that's glutamatergic. Okay. And this is in the absence of dopamine. This is just the indirect pathway by itself without the influence of dopamine. Yes?
So with these pathways kind of like jumping all around these different structures in the brain, are they picking up or dropping off any information at each individual structure that they're passing through?
It's a series, so there's a balance between the depolarization and the hyperpolarization that's happening. That's it. That's how things are communicated electrochemically. Okay, with the electrical signal, the action potential, and the chemical signal, the neurotransmitter release. Okay, any other questions? All right, let's look at what happens here. So if there's an increase in glutamate at this point, glutamate is going to cause depolarization of the next neuron in sequence. So that's going to result in a release of GABA at this point, since this is a blue neuron, releases GABAergic neuron. So you're going to have an increase in GABA here. Bless you. If you have an increase in GABA at this synaptic cleft, then you're going to have a hyperpolarization of this neuron. Okay, so you're going to have less GABA here. Okay, less GABA is going to result in a depolarization of the next neuron in sequence, which is a glutamate releasing neuron. So you're going to release GABA, glutamate. That synaptic cleft. If you release glutamate here, that's going to cause a depolarization here, resulting in the release of GABA at this synapse. So you're going to have more GABA here. Releasing GABA on this neuron is going to cause a decrease in movement. So you're going to inhibit unwanted movement. And that's why it's called the stop pathway. Indirect stop unwanted movement, direct go, initiate movement. Question, is it starting to make sense? No, Hannah, this has...
From the subthalamic to the GPI, was that, you said repolarization or?
No? Okay, so if you have a decrease in GABA here, that's going to result in depolarization of that glutamate releasing neuron, causing the release of glutamate here, which also causes a depolarization here. Increased GABA inhibits that from firing. Does that make sense? So if you think about the colors and the release and what should happen. Hello?
And unwanted movement is different from like stopping with your hands. This is like not shaking around.
Well, we'll see a video at the end. You'll see what unwanted movement is. Okay? Any other questions? I'll show, there's a video, some patients with Parkinson's diagnosis, and a video of patients with Huntington's diagnosis that you're going to see. And that'll give you a really good feel for the differences between the two patient populations. Any other questions about this? Okay, this is the indirect pathway. Now, let's look at the indirect pathway plus dopamine and see what happens. Okay, so all the same players should be pretty good with them by now. Let's go through and label. Here's your substantia nigra. Here's your subthalamic nucleus. We're already running out of pens. Here's your thalamus. I, GP, E, putamen, caudate. And again, we have motor cortex. And you're thinking about moving. Same as anything, and what I'm going to start out doing is draw just the indirect pathway without dopamine again, just to go through it one more time. So you have neural cell body here in the motor cortex, releases axons, to the striatum, which is the caudate and the putamen. Synapse with a GABAergic neuron that sends out axons to the GPE. Okay, those axons synapse with another GABAergic neuron in the GPE. And GPE, neural cell body, sends out axons to the subthalamic nucleus here. And synapses with the glutamatergic neural cell body and the subthalamic nucleus, sends out axons to the GPI. Synapses with GABAergic neuron, GPI, sends out axons to the thalamus. Okay, synapse with the glutamatergic neuron and then the thalamus. Okay, same pathway we just drew, nothing different. So the neural cell body, for axon synapse in the caudate nucleus and the putamen from motor cortex. Synapse with a GABAergic neuron, sends out axons to E, sends out axons to subthalamic nucleus. That glutamatergic neuron sends out an axon to the GPI. That synapse is with a GABAergic neuron going to the thalamus. Okay, that's the indirect pathway. Now let's look at the, again, nigrostriatal. So we're going to have axons coming out of the substantia nigra that come up and synapse in the striatum, which is the putamen and the caudate. All right. Before we know what's going to happen, we have to know what kind of receptors are on these neural cell bodies here, these GABAergic neurons. And I can tell you that they are in the case of the indirect pathway, these are D2 receptors. Dopamine releasing. Okay. So, glutamate here is going to tend to go for depolarization, but having the D2 receptors rules, so you're going to have a hyperpolarization of the next neuron in sequence. So this is going to result in a decrease of GABA here compared to without dopamine. You have less GABA here. That's going to tend to more depolarize the next neuron in sequence. That's going to result in an increase in GABA here. There's an increase in GABA here. You're going to have less glutamate released here. There's less glutamate here. You're going to have less GABA here. Less GABA, that's going to release this neuron from inhibition, which is going to result in an increase in even unwanted movement. Okay, and that's the indirect pathway in the presence with dopamine. Okay, and again, the best way to think about it is you're just focusing on the change in the concentration of neurotransmitters at each area and thinking about whether that's going to lead to depolarization or hyperpolarization. Questions about that one? Okay, moving on then to the last one is going to be looking at what happens with Huntington's disease. Like I said, I have some videos that we can look at too. Huntington's disease, as I mentioned previously, is going to be a problem with the indirect pathway. And specifically in Huntington's disease, we're going to lose the influence or the input from the caudate nucleus. So in patients with Huntington's, that caudate nucleus actually starts to shrink and shrivel away, and because of that you see an enlargement, or you visualize an enlargement of the lateral ventricles because that caudate shrinks. Alright, let's go ahead and label everybody again. So substantia nigra, subthalamic nucleus, thalamus, GPI, GPE, and this guy got canceled out, but he's the caudate nucleus. So Huntington's is deterioration of caudate. And up here we also have our motor cortex. About movement. I don't know. Thanks for letting me know. I would have never looked. Makes it a little blurry. All right, so we have everything is going to be the same, except we lose the influence of the GABAergic neuron coming from the caudate nucleus. So here you have your glutamatergic neuron in the motor cortex comes down, and synapses only with the neural cell body in the putamen. Putamen synapses with that GABAergic neuron sends out axons to the GPE. Synapses with neural cell body, GABAergic, sends out axons to the subthalamic nucleus. Synapses with glutamatergic neuron, subthalamic nucleus, sends out axons to the GPI. Synapses with GABAergic neuron and GPI, sends out axons to the thalamus. Synapses with the glutamatergic neuron, communicates with the motor cortex. Why it keeps going in and out of focus. But same pathway. The only difference there is we're lacking the influence from the caudate nucleus. Okay, so there's going to be no input from the caudate nucleus. And if you draw in the dopamine releasing neurons, so they're just now coming from substantia nigra, just like before. Axons are going to synapse here with this GABAergic neuron in the putamen. Remember that that GABAergic neuron has D2 receptors, so it's going to result in hyperpolarization. So, glutamate is released here, but you also have this being released here. But remember, you're losing the influence of the coming in from the caudate nucleus. So you have the positive is going to outweigh the influence of the negative. So you're going to have even less GABA overall. So you're going to have less GABA here. Okay, if you have less GABA here, you're going to have this fire, or more likely to depolarize. Okay, depolarization is going to result in an increase in GABA here. Okay, increase in GABA here is going to result in even less glutamate being released here. And if there's less glutamate being released here, then you're going to have even less GABA being released here. And that's going to result in this being released from inhibition, and you're going to have a pretty big increase in unwanted movement. Yes, Alex.
So you said the neuronal cell body is going from the motor cortex initially to the
Putamen.
It's gonna overpower the dopamine releasing, right?
Say that. I don't know what I said honestly, but let me look at it and let's talk through it. Okay, so you have your glutamate. So what happened before is that the dopamine was actually overpowering. So since you have 1 and 1, so it actually ends up being the dopamine that's overpowering to have less GABA being released there. Does that make more sense? I'm sorry if I misspoke. Yeah, I said it wrong. Just trying to go through and make sense of it. But the dopamine added to the system is the more powerful. Okay, in both the case of Huntington's as well as the influence in the indirect pathway overall. Okay, but you lose the influence of the caudate nucleus, which makes less GABA available. Okay, that's where that comes from. Okay, other questions? It takes a while to go through and try and follow everything. Let's go ahead and